Hi guys, so today we're going to look at the digestive system anatomy, part 3. This time it is the small intestine, so I highly recommend you to go and check out the third part. No, sorry, not the third part, I mean the second part and the first part. So let's get into it. So, the small intestine is approximately 7 meters long, and it's actually the primary site of where chemical digestion is completed, follow along with the absorption of nutrients. Now, the small intestine can actually be split up into three parts. First, you got the ileum, the duodenum, and the gymen itself. So, looking at the first part of the small intestine is actually where the duodenum is at. So, it is actually distinguished by the presence of burner glands. Now, these burner glands are actually going to produce bicarbonate rich mucus that into the lumen itself. That what happens is that they're going to neutralize the acid chime, preventing the acid from actually entering the duodenum itself. So if you look at the first part of the duodenum, you can see how it is made up of a smooth wall of like tissue, right? So that is what we call intraperitoneal, meaning it actually has no circular folds. Now, if you see on the left side, the live X-ray, you can see that will be the stomach, the pylorus sphincter, and the first part of the duodenum itself. Now, will be a more clear diagram. You can see the hepatico-duolingo ligament down here, which forms the lesser momentum down here, and you can see the first part of the duodenum, which is intraperitoneal. Now, the rest of the duodenum, when we're talking about the second or fourth one, it is all retroperitoneal, meaning it actually consists of circular folds. Now, the second part, right? Like I said, it is retroperitoneal, meaning it consists of circular folds to increase the surface area, allowing for the absorption of nutrients. Now, you can see here, this is the common bile duct and the pancreatic duct itself. And what happens is that they are going to form the major duolingo peptida, and this actually allows bile and pancreatic juice to actually flow into the duodenum itself, allowing to help with the chemical digestion of food itself. Now, the third part, right, you actually can see here the superior mesipic artery and vein. And what happens is that they're going to cross over the third part of the duodenum itself. Now, the fourth part of the fourth part of the duodenum, right? I like to call this a junction. Why? Essentially because you can see the third part is made out of retroperitoneal, meaning it has circular folds, and then it slowly turns into intraperitoneal, into the fourth one. So that's why it's called the retroperitoneal and intraperitoneal junction, or I like to call it the duodeno-jejunal junction itself. And if we were to look here on the left side, you can see how the fourth part of the duodenum is actually held together by the ligament of Treis, which ascends all the way up to the diaphragm itself. Now from here, you actually can see a clearer diagram now here. You can see how that part is retroperitoneal and then followed by intraperitoneal. You can see the different layers. This one is much more whiter. This one's much more, a bit less white. And then you can see the duodenal junction right there. You can see the junction there. Now, the small intestine, like I said, is split up into three parts. So the ileum is actually located at the lower right quadrant, while the jejunum, right, is actually located in the left upper quadrant. Now, the small intestines, right, are actually so you're looking actually at a sagittal section of the body, and what happens is that you can see the stomach up there, the liver, the small intestine, the large intestine, the bladder, and then that would be your anus right there. And what happens is that we're talking about the mysterious phase. So the mysterious is basically a fold of the membrane that actually attaches to the intestines and the walls around the stomach area to kind of give it stability and hold it in place. Now you can see a difference between the gymen and the ileum itself. How the gymen is made out of retroperitoneal, meaning it consists of circular folds that increases the surface area for absorption of nutrients. And you can see the ileum itself where it is intraperitoneal, meaning it does not have as much as circular folds. So you can see how is the difference of texture between those two. Now this is a live cadaver. You can see how on the top part of the duodenum, right, it is retroperitoneal. So look at all of those villas right there. So those villas actually cover a large surface area, allowing the increased absorption of diffusion, allowing for diffusion to happen more often. And then it slowly goes down, and then you can see the ileum itself where it is intraperitoneal, meaning it doesn't have as much circular folds as the jugymen itself. Okay, so the ileum actually consists of patches, Peyer's patches itself. So Peyer's patches is actually made out of dense lymphoid nodes in the lamina propria itself. And what happens is that they are primarily found in the distal ileum itself. And the function of these, right, is actually to help monitor intestinal bacteria and facilitate immune response too. Now, the ileociliary valve, right, is actually located at the end of the ileum itself or the small intestine, and it actually marks the junction with the cilium itself of the large intestine. So you can see here how the ileum will end itself at the cilium itself and form the ileociliary valve. Now, this actually allows chyme to actually flow from the ileum into the cilium itself. And this actually marks the end of the small intestine. So the reason why it's actually called a valve is actually because as chyme was to flow into the ileum into the cilium, it prevents backflow of chyme from the large intestine back to the small intestine. And that, my friends, is the end of the small intestine. So I hope you enjoyed this video, and please do and check out go ahead and check out part one and part two of the uh, digestive system anatomy. And I hope you've learned something from this video. Take care and peace.